Good morning and welcome to this wonderful conference. Truly one of my biggest regrets during this COVID lockdown is not being there with all of you in person in Kyrgyzstan. I am deeply grateful to Daniel and Tolkien for their amazing efforts to pull off this virtual conference and honored to present before you all. Today I would like to briefly present data on how social distancing and economic consequences of COVID-19 are creating a surge of violence against women around the world, and then present an overview of the evidence-based computerized WINGS tool to prevent gender-based violence. I will also discuss how WINGS may be used to pivot around the social distancing restrictions of COVID and how it may advance a coordinated community response to gender-based violence with community-level interventions like Sunflower, as well as identify some of the future directions of WINGS that we are taking. So, from January to March 2020, when the implementation of quarantine restrictions happened in Kyrgyzstan, there's been a 65% increase in domestic violence complaints in Kyrgyzstan from the same time period in 2019. Data from around the world also suggests that there's been a surge in domestic violence reports among women since quarantine measures were implemented in different countries. Some countries like Brazil and India found an initial decrease in domestic violence calls to agencies before they implemented text-based hotlines, where they began to see alarming increases. The dramatic increase in domestic violence reports during COVID are very similar to surges that were experienced during other national disasters like Hurricane Katrina and Ebola. The most comprehensive assessment that I've found so far on the impact of COVID on gender-based violence was recently conducted by the UNTF of 100 partner agencies in 69 countries. This assessment found significant increases in all types of violence against women and found women experiencing violence have faced major barriers in accessing emergency care, police, and legal protection. However, on the positive side, this assessment also indicated that many domestic violence programs are pivoting around these barriers through technology, social media outreach, and deploying discrete gender-based violence services through mainstream essential places like pharmacies and grocery stores that have remained open. I apologize for this busy slide, but I want to introduce an ecosystem framework for considering how COVID-related social distancing and economic consequences may impact multi-level risk and protective factors that we know are associated with violence against women. We do know from previous disasters that these social distancing and economic effects of COVID are likely to continue to create a surge of violence, particularly among minority women and more marginalized populations of women, like women who use drugs. The quarantine restrictions and funding cuts to domestic violence agencies may further impede their ability to reach and respond to women experiencing violence. As I mentioned before, however, domestic violence providers around the world are stepping up to reach out, engage, and intervene with women experiencing violence using innovative digital technologies. I think these technologies have the potential to extend the reach of domestic violence services to engage a much broader population of women at risk of violence, even after the threat of COVID is over. And I just want to take a moment here to acknowledge all of you in the audience who are working to serve women at risk of violence during this unprecedented time, often at cost to your own personal well-being. You are on the front lines of essential workers like nurses and doctors, and we need to ensure that we are working to prevent burnout and provide the support you need to meet the increased demand for domestic violence services. More than a decade ago, I began thinking about creating the computerized WINGS tool as a way to reach out and identify and help all women who use drugs experiencing IPV who are not able to access services for domestic violence. At that time, research was showing that only 6% of women who use drugs and needed domestic violence services were actually receiving them. So I began to think of WINGS as a brief computerized self-paced intervention that could be deployed in a wide range of community settings like community corrections, emergency care, harm reduction programs, and through social media. Now again, during this unprecedented time of COVID, I'm thinking of how we can possibly use WINGS to reach a much greater population of women who use drugs and other groups of women at risk. In 2011, we developed and evaluated the computerized tool of WINGS in a randomized control trial with women who use drugs in community correction settings in New York City, and found it to be equally effective in identifying and reducing different types of violence as the traditional WINGS intervention delivered by a facilitator. Over the past 10 years, we've adapted and evaluated WINGS with different populations of women at risk around the world, including women who engage in sex work, women who are refugees or are internally displaced, adolescent women, and rural women. We've integrated modules of HIV counseling and testing and overdose education and naloxone distribution into WINGS, and are currently working to develop brief sexual reproductive health and mental health screening and referral modules. WINGS has been translated into 8 languages and is currently being implemented in 6 countries. WINGS is guided by motivational interviewing principles that are fundamental to harm reduction. These principles include the use of motivational interviewing techniques of asking open-ended questions, actively affirming what women are saying by using reflective listening, and summarizing. Consistent with harm reduction principles, WINGS recognizes that women are the experts on their own situations and should be given full agency to take the steps they want to take to reduce their harms of violence. WINGS also recognizes that poverty, racism, sexism, heterosexism, and other social inequalities affect both women's vulnerability to violence and substance misuse and their ability to access support and appropriate services to deal with these issues. WINGS has 8 core components, including a brief psychoeducation component that is designed to raise awareness of different types of intimate partner violence and gender-based violence and how drug involvement interacts with these types of violence. It includes an evidence-based screening tool on different types of violence and gender-based violence, and provides feedback on their level of risk. WINGS also has a component to elicit motivation for relationship safety, and then launches into a safety planning exercise to identify concrete steps women can take to increase their physical and sexual safety during violent episodes, as well as to identify family, friends, and other folks in their social network who can provide emotional support, advice, and concrete resources like loans or temporary housing. There are several benefits of the computerized self-paced model of WINGS, which has now been turned into an app that may help with the challenges of providing direct services to women during the COVID social distancing restrictions, including that it provides a greater confidentiality and privacy for women who may be fearful of disclosing violence on a phone conversation. Computerized self-paced versions can also be culturally tailored and translated into different languages to extend their reach to minority women. Moreover, the data from the computerized version can be downloaded real-time and aggregated to track informal surveillance and identify surges in different types of gender-based violence among marginalized populations of women that may be happening during COVID. Over the past decade, we have conducted implementation research on deploying WINGS in different settings. This research has identified 6 main components that are needed to successfully implement WINGS, including ensuring that staff have sufficient training and ongoing supervision in implementing WINGS. Leadership commitment to WINGS is also essential to ensure that staff have adequate time, tools, and confidential space to deliver WINGS. Lastly, and probably most importantly, it is critical that different programs delivering WINGS need to coordinate the service delivery with other key stakeholder agencies in the community to ensure a coordinated service strategy where women can access services from multiple settings. concept is there's no wrong door to access services. Forming coalitions of key stakeholders from harm reduction, drug treatment, legal services, housing, employment, and trauma-informed mental health services is critical. Coalitions of these different key stakeholders can also work together to raise awareness about gender-based violence, promote norms of zero tolerance towards gender-based violence among women who use drugs, and advocate together for policy funding and programs to tackle gender-based violence. I'm really looking forward to learning more about the integration of WINGS with the community-based approach of Sunflower. I think this is really what is needed most to move upstream to tackle gender-based violence at this point. Our vision now for WINGS is to continue scaling up WINGS to reach different marginalized population of women most at risk of violence, to build capacity of communities, organizations, to document the scope and severity of gender-based violence with an eye to inform policy and program changes, and to integrate WINGS into coordinated community responses that address gender-based violence. I wish you all a productive conference, and I'm very eager to hear more about your lessons learned from implementing WINGS. I'm particularly interested in learning what type of resources, training, and technical assistance organizations and staff need to implement WINGS. To scale up and sustain WINGS, we also need to grapple with identifying and securing more secure funding sources for WINGS from government and other funders. We also need to consider how we can move towards more formally collecting and analyzing data on incidence and prevalence of different types of gender-based violence among women who use drugs and other marginalized groups of women to guide policy and program efforts. As I mentioned before, I think it's critically important to create and maintain a coordinated network of gender-based violence services in communities to achieve a larger population effect in tackling gender-based violence. I truly look forward to hearing from all of you and welcome your thoughts and feedback about potential next steps we can take to scale up WINGS. Here's my contact information and the website for WINGS. Thank you.